Thank you, Mr. Speaker, sir, for your indulgence. Mr. Speaker, a statement on an issue of general topical concern on the complete shutdown of medical services due to health workers' strike in Nandi County. Mr. Speaker, sir, I rise pursuant to Standing Order 52.1 to make a statement on an issue of general topical concern and national importance, namely complete shutdown of medical services in Nandi County due to ongoing health workers' strike starting from Kapsabet County Referral Hospital. Mr. Speaker, sir, Nandi County is faced with serious health crisis occasioned by the health workers that is currently ongoing, affecting general all the health workers in the county as we talk. Mr. Speaker, sir, the county government of Nandi has failed to address the issues affecting doctors, nurses, clinical officers, and other health workers. These issues include harmonizing promotion of staff, poor working condition, non-remittance of statutory deductions, non-remittance on SACCO loans and union dues, yet they have been deducted on the pay slip, and the lack of medical cover to staff. Mr. Speaker, sir, other issues by the health workers include the illegal mass sacking and staff removal from payroll in an exercise that the governor himself bloated the wage bill by a public service board under the patronage of Governor Sang on 13 March 2023 at Kaimosi Agricultural Training Center, conducted a verification exercise and head count on staff, whereby they verified the following from the staff. 1, original and copies of national ID, appointment letters, pay slips and academic / professional certificates including valid licenses, then issued them with letters in an event presided over by Governor Sang on 11 May 2023 after successful verification. Mr. Speaker, sir, Mr. Sang himself created the mess in the County Public Service Commission by illegally and regularly employing his cronies, siblings, political spin masters, campaign soloists, goons, radio callers, and political masseurs, whereby they were all in the payroll and have been earning from the Nandi County covers for the last 7 years, and the governor now purports to deny them that he knows nothing about it. As we speak, Nandi County, with the ongoing strike, nothing is moving. From medical services, no development project, almost all county roads, no clean water, no bursary allocation, and there are no drugs in all hospitals, including at the Kapsabet County Referral Hospital. The mortuary in Kapsabet has not been functional for over an year now, and Kapsabet County Referral Hospital, Mr. Speaker, also on its deathbed. No drugs in all hospitals and dispensaries and healthcare centers in Nandi County, yet according to the latest report of the Auditor General, shows that massive spending on foreign travels by the county executive led by the governor to totaling over Kenya shillings 310 million in the financial year 2022-2023. This is very unfortunate. Mr. Speaker, sir, despite having received over 60 billion through the shareable revenue allocated to Nandi County in 7 years, among other sources such as own source revenue and conditional grants, Governor Sang should therefore take personal responsibility for the mess in Nandi County and be held liable as a chief county executive officer in charge of the county, and stop subjecting innocent workers to torture and joblessness and causing lack of service delivery to the people of Nandi, including but not limited to complete shutdown of medical services. Mr. Speaker, sir, I urge the Nandi County Assembly and MCAs to immediately table an impeachment motion on the governor on these glaring offenses and violation of the Constitution and other laws, which I know we shall uphold at the Senate when that time comes. Mr. Speaker, sir, the move by the County Assembly to form ad hoc committee on the investigation in the departmental operations by CCMs is a smokescreen and diversionary tactics to absolve the governor, the people of Nandi, in overwhelming support that continues to in effect the service delivery. Mr. Speaker, sir, in finality, if the MCAs do not impeach the governor on these allegations, then the people of Nandi will start collection of signatures to remove the governor, the investigations of the fraud by the payroll should be handled by the DCI headquarters, noting that during meter interview in Nandi County, the CCIO stated that the governor was not aware of this illegality, yet investigations are still ongoing, and up to now, no one has been arraigned in court of law. Mr. Speaker, looking at these offenses and by the Nandi County Assembly's MCAs, these are serious grounds to impeach the governor. Mr. Speaker, sir, in finality, for health care services to be restored, roads to be fixed, wage bill to be sorted, and development to be realized in Nandi County, Sang must go and must be impeached. I thank you, Mr. Speaker.
Statement pursuant to Standing Order 53-1, Honorable Senator Richard Onyonka.
Thank you, Mr. Speaker, for giving me the opportunity. Mr. Speaker, I rise pursuant to Standing Order number 53-1 to seek a statement from the Standing Committee on Health regarding the Integrated Health Information Technology System, IHTS, project of the Social Health Authority, which aims to digitize Kenya's health infrastructure by interconnecting patients, doctors, hospitals, and health services on a unified platform. Mr. Speaker, the system is going to be worth over 104 billion shillings annually, and it was awarded to a consortium comprising of Safaricom, Apiero Limited, and Convergence Network Solutions. In the statement, Mr. Speaker, I would want the committee to explain the ownership model for the Integrated Health Information Technology System and state whether national security system assessment was done, considering that this system will connect our country's health infrastructure, including patients, doctors, hospitals, health products, and health financing on this unified platform. Number two, Mr. Speaker, I hope that the committee will be able to explain how a foreign entity was engaged to leverage the country's health system. Number three, Mr. Speaker, I would want the committee to outline the distinct roles and responsibilities between the Ministry of Health, the Social Health Authority, in the procurement and oversight of the IHTS system, specifying the monthly payment terms that have been agreed upon between the consortium and the Ministry of Health, SHA, and whether these payments are linked to the performance matrices or milestones achievable. Number four, Mr. Speaker, I would want the committee to find out whether there's a detailed specific improvements in our healthcare delivery and patient outcomes expected by the Ministry of Health following the implementation of the IHTS system. Number five, Mr. Speaker, I would want the committee to provide details of the consortium of Safaricom.
Order, honorable senators. May Senator Onyonka be heard in silence, please.
Thank you, Mr. Speaker. Provide the details of the consortium Safaricom, Apiero Limited, Convergence Network Systems, and the roles of each partner in delivering the IHTS system consolidated fund, which will be used if premiums are inadequate to meet the contracted amounts. Number seven, Mr. Speaker, I would want the committee to state the measures in place to mitigate delays during this rollout, especially in rural areas with limited infrastructure, and indicate the contingencies or penalties in which the consortium, if it fails to deliver in time or to meet performance targets, on what responsibilities they'll hold. Finally, Mr. Speaker, I would state that I would want the committee to provide us the projected timeline for completing critical milestones such as delivering the 7,000 tablets and 5,000 laptops which they have promised to deliver. Thank you, Mr. Speaker.
Senator AJAABU.
Thank you, Mr. Speaker. Mr. Speaker, sir, I rise pursuant to Standing Order 53-1 to seek a statement from the Standing Committee on Finance and Budget regarding the financial operation